Hi, I'm Steph and I'm a breastfeeding counsellor, and I'm going to talk to you a little bit today about expressing colostrum before your baby's born. So colostrum is the milk that's produced from around halfway through your pregnancy, and it's the milk that your baby will have if you're planning to breastfeed for the first few days of their life until your milk changes into mature milk. So colostrum is jam-packed with immunofactors for your baby, and it's kind of their first immunisation almost, and it really kind of kickstarts their immune system. It is produced from around halfway through your pregnancy, and so it will be in your body at the moment, ready for when your baby's born. So today we're going to think about why we might express, when we might express, and how to do it. So expressing colostrum can be recommended for some mums, particularly if they have gestational diabetes, if they're having twins or multiples, or if they are having a planned cesarean birth. And this can be because it can be helpful to have a little bit of extra milk if your baby is slow or struggling with breastfeeding in the early days. But recently, lots of mums have been asking about it, and I wanted to give you a little bit more information about it. So, why might you express? So for any of those reasons that I just mentioned, but also the act of hand expressing, if you like, is a really good skill to have, and it can help you to become familiar with your breasts before your baby's born. It's a really good skill to have to help to encourage your baby to come to the breast. So maybe enticing them with a little bit of expressed milk. If your baby's a bit sleepy or slow to latch on in the early days and you want to give them a little bit of top-up milk. If maybe their blood sugar levels are a little bit low, which can sometimes happen if mum's had gestational diabetes. So rather than using formula, you can use your own colostrum to top your baby up and have a little bit of extra milk for them. And like I said, it's just a really good skill to have throughout your breastfeeding journey. So when might we do it? It's advised to wait till around 37 weeks to express, and this is because sometimes the act of expressing, so the nipple stimulation, can kind of start contractions. We know that the same hormones are involved. What I would advise is if you do try expressing and you feel any tightenings, then just stop and don't try again. And those tightenings should hopefully go away. But always speak to your midwife before you try this anyway, and they can have a chat with you about it as well. So we've done kind of why and when, so let's think about how you might express. So the first thing is to have everything that you need to hand before you start. And one of those things that's useful to have is a syringe. So this is just a little 1 milliliter syringe, you can see, and it's in a sterile packaging. This one hasn't been opened at all. And you can get these, sometimes your midwife will give you a pack of these if you ask, or you can get them from Amazon in kind of packs of 10, 20, and they're not too expensive. So have a look. I'll pop a link in the story below so that you can see. This is what the syringe looks like out of the packet. I've popped a label on here, as you can see, and we'll talk about why in a little while. So having a syringe, you can get these in kind of 1 ml. This is a 1 ml syringe. You can get 2 or 5 mils, but colostrum is produced in very small amounts, so you don't need a big syringe at all. So these little 1 ml syringes are quite good for storing the milk. So have one of those to hand, or a couple of those, and then you might want, if you're not expressing straight into the syringe, you could have a sterile spoon. This one's quite a shallow teaspoon, might get a bit wobbly, you don't want to spill any, so you could use kind of a deeper spoon like this, making sure it's sterile. So this is just a measuring spoon, or a little sterile plastic pot, and then if you collect any colostrum in that, you can just draw it up into the syringe and store it in the syringe. So having everything to hand is really helpful. And then you're going to be thinking about the kind of environment that you're going to be in. Obviously, you want quite a private space, somewhere that you feel warm and comfortable and relaxed. And you might want to play some nice music. You could maybe look at a scan picture of your baby while you're doing it. And you're going to make sure that you're feeling comfortable and happy when you're doing it. So you could start by having a nice warm bath or a shower. And when you're in the bath or shower, you can just start by gently massaging around your breast. So just very gently. If you're not having a bath or shower beforehand, and it's not compulsory at all, you could pop a warm flannel on your breast. Just massaging around just before you do the expressing. And then when you're going to start expressing, you want to have your hand in a kind of C shape. And we're just going to feel back from the nipple. And we're just going to feel back and we're just going to squeeze and release. Squeeze and release. And just do this nice and slowly and gently. And after a little while, you might notice just a few little drops of milk just collecting on the end of the nipple. You're just going to carry on squeezing. And when it forms a little globule, if you like, you can just suck that up directly into the syringe, or you can catch it in the spoon or in your pot, whatever you've got to hand. So you're just letting that drip into the pot, and you can syringe that up afterwards. And when you've finished, when you kind of notice that there's no more milk coming out, what you're going to do is rotate your hand and then just repeat that again. Repeat that whole process. Again, kind of just squeezing, noticing maybe a few drops of milk, collecting those in the same syringe or in the pot. And then when that milk stops flowing on that side, again, moving your hands around and doing the same. And what you're aiming to do is kind of go around the whole clock face, if you like, squeezing in a few times in each place. And then obviously repeating on the other side. And what you'll find is that you'll get a very small amount. So this is why we're talking only kind of 1 ml syringe. You might get kind of 0.1, 0.2 of a milliliter from each breast, maybe not even that, and that's fine. Not all mums will manage to express any colostrum antenatally, and that's perfectly normal, and it doesn't mean that you're going to struggle with breastfeeding or anything like that. So it's normal to be able to collect a bit. It's normal to not be able to collect a bit, but just have a go and see if you manage to collect a little bit. And so when we've got the colostrum in our syringe, what we're going to do, I've put a sticker on mine. It's a good idea to put your name on there and your date of birth, and also the date that you collected that colostrum. And you can keep this in a plastic bag. So just like this one, it's a Ziploc kind of resealable bag, and you can pop that in there. You could keep that in the fridge at the back, and if you express again the same day within 24 hours, you can add that to the same syringe, and you can keep that, then transfer it into the freezer. And then if you manage to collect any over the next few days, you can add that syringe into the same bag. So you've got a few syringes in there. You can just pop it back into the little sterile packet that it comes with. It's totally up to you. And then if you need your colostrum once your baby's born, you can take it out of the freezer, pop it in a freezer bag with some blocks. You could just take it anyway into the hospital or birth centre with you when you go in to have your baby. Once you get to the hospital or the birth centre, you can ask your midwife to store that milk in the freezer or the fridge. And you can then have that on hand if you need it with your baby once your baby's born. Now, in terms of defrosting the milk, it's such a tiny little syringe, very thin, you can see, that just kind of holding it in your hand will defrost that in kind of a minute or so. So just holding it and the warmth of your hand will defrost that, or you can just kind of run some warm water over the syringe to defrost it a little quicker. But that's all you need, really. So like I said, don't be disheartened if you try and you don't get any milk. That's perfectly normal. You can maybe try again the next day. And you can, I would say, do this between 1 and 3 times in a day. Space it out. Like I said, make sure that you're feeling happy and relaxed and warm and comfortable when you try it. And yeah, see how you go. If you've got any questions, you can put them under the post here, and I'll try and answer those as soon as I can.